Hello, hello everyone. Good afternoon. Myself, Dr. Madan Mahalle. I am a pediatrician, and we are having our clinic and hospital in Akola. So our hospital is Vithai Child Care Clinic and Vithai Bal Rugnalay, Jetharpet Square, Akola at Korde Hospital. And we both spouse, myself and my wife, we are pediatricians, and we are here to discuss today about common skin problems in newborn. So when newborn baby is born, we need to think about skin care, because as we know, skin is the largest organ of our human body, and newborn skin is very different from adult skin in various aspects. As newborns are very delicate, so their skin is, and there are many common things, common issues with skin of newborn, particularly in first few days or 1 month of life, and we need to take special care, because uh, in this summer it may be having some dehydration due to some temperature issues. So what are the special care we need to take? As we know, delicate skin is having their definite pH, we call, that is around 5.5. So we need to maintain that. We cannot use routine soap, detergent, or cosmetic products for newborn skin. And proper hydration, temperature maintenance is also equally important for newborn skin. When we have newborn baby in our family, then all the caretakers should know proper care of skin of newborn. If baby is preterm, premature, then extra care must be taken regarding the skin. If baby is post-dated or full-term baby, their skin conditions and problems are little different. We should avoid any irritant application, sudden temperature changes, like very cold temperature of your room and suddenly taking baby to outdoor environment. We should avoid excessive bathing with normal soaps and detergents. It disturbs their normal natural pH. And not only skin, hair and nails are also skin appendages. So newborn scalp, hair and nail care is also equally important. So what are normal skin problems in newborn? There may be some birthmarks, if any, then some mild skin birth injuries. If delivery was difficult, instrumental, assisted delivery, or cesarean section delivery, then we need to take care of some birth injuries if there are any. And as we know, in difficult deliveries, or it is, if it is post dated or premature delivery, then some difficult some extra efforts need to be taken. So starting from head to toe, starting from head to toe, uh, head and hairs, scalp may have some sparse hair, or hair growth may be little less in newborn period. Forehead and shoulder may have some baby hairs, so those are pretty normal for newborns. They will shed off of its own in few days, and normal hair will take place. Normal hair growth will take place. If excessive oil application is done, as our country is having various tradition, various different parts of our country, then it may form some hair tuft, or we call cradle cap like thing on scalp, which will present with some thick scales on scalp of the baby. Sometimes there may be seborrheic dermatitis of scalp of the baby. On face and forehead, there may be some neonatal acne. These are very normal thing. Small pinhead, yellowish lesions. This will go of its own. Nothing to do. Nothing extra should be done for that. And there may be some birthmark, what we call angel kiss on neck of the baby, or forehead, we call stalk bites, reddish capillary like or lining like marks. And more common is milia and miliaria, particularly in this season when it is very hot and humid all over. So in summer season, or if baby gets overwrapped, or temperature is not maintained properly in the room, then milia and miliaria are very pretty common. For that, just normal skincare is enough. No extra treatment is required. In first week of life, from second to third day, up to 2 weeks, there may be some reddish spots all over the body. What we call is erythema toxicum in medical term. So those are also very normal. These are nothing but the baby's skin is taking some time to get adjusted to the new external environment, new clothes and fabrics. Some neonatal pustulosis may be there. As we know, pustules are nothing but the few lesion with yellowish pus-filled lesions. Actually, if there are only 1 to 2 or few lesions, and that too in different areas, nothing to be done, just wait and watch. If these lesions are growing very rapidly and in danger areas as in around umbilical cord, on face, in groin, around private parts, and multiple in number and large in size, then we need to take care of it. Then we need to consult dermatologist or neonatologist or pediatrician. And particularly at umbilical site, because umbilicus is very delicate area in first few weeks of life. After shedding of umbilical cord, there may be some pink reddish granulation tissue, excessive granulation tissue, what we call, that may form watery discharging lesion from umbilicus. We call it umbilical granuloma. And very rarely there may be some umbilical polyp which may need some treatment. So if there is persistent watery discharge from umbilicus and redness around it, then please consult even pediatrician or dermatologist. Then more common is nowadays what we are seeing is diaper rash. Most of the caretakers use diapers for babies right from the birth. It is okay to use diapers when baby is in traveling, or when you are out of home for some reason, or going to clinic. For some duration it is okay, but what we suggest, we should minimize the use of diapers, because when diaper gets wet, soiled due to urine or stools, and it stays for long duration, and that contact of urine and stool with baby's delicate skin may cause diaper rash, or what we call contact dermatitis. If it is very red around that area, around perianal or in groin, then you need to consult your dermatologist or pediatrician. And one more common skin change in newborn is, if baby is near term or full term, 9 month completed and then got delivered, then in first few days baby's skin may shed off naturally, normally, and there you can observe desquamation. Superficial layer of skin may shed of its own. Nothing to be done for that, just normal skin care is adequate. Now coming to some birthmarks. Some babies may have some dark blackish spots, particularly on trunk, back, and sometimes upper body, front side also. Those are very normal, what we call Mongolian spots. If these are very few or less in size, nothing to be worried for. You can just wait and watch. They will fade off its own in few months or years. If there are extensive Mongolian spots all over the body, then you need to consult your doctor. And one more important thing I would like to share here, that baby's skin color is very important. Normal healthy baby skin will be pink, and if you find any different shade or different color of baby, then you need to consult your doctor, particularly yellowish tinge, because neonatal jaundice is very common, particularly in summer days when babies are dehydrated. Now I am happy to take questions. Most common questions we found in our day-to-day practice is, can we use coconut oil for babies? Yes, we can. Actually, we need to observe whatever cosmetic product, oil we are using for baby is getting suited for baby or not. For that, we suggest apply just very small quantity below knee on foot for first 2-3 days, and if baby skin tolerates it, then you can use that. And most common question we get in summer season is, are the boils normal on my baby's body during summer? Frankly speaking, boils are not normal. In summer season, due to humid and hot condition, uh, baby's skin, delicate skin, is very prone for infections. So if you find boil-like lesion on baby's body, then please consult your pediatrician doctor, because boils are infective lesions. So a stitch in time may save 9. And diapers are good, but it should be restricted for its use for very short duration, in emergencies, in travel, when you are going out of home. And at home, we will suggest minimize the use of diapers, and they should be frequently changed. And most important thing, there are some red flags or danger signs about the skin lesions. If baby's skin color suddenly changes, it is concern, it is thing to concern, and then you need to visit your doctor immediately. As we discussed, if you found baby's skin is a little yellowish tinge, then it may be the jaundice, then you need to consult your doctor. If baby's skin color, extremities, temperature suddenly changes, normally what we expect, warm baby, not hot, warm baby. And if baby's extremities or forehead or body, you feel it is very cold, then you should visit your doctor, consult your doctor immediately. If you find any skin lesion, multiple in number, growing very rapidly in hours or few days, and particularly in danger areas on face and private parts, then you should consult your doctor. Most important is if you find any sudden change in baby's uh, activity, cry, hunger, feeding, sleep pattern, then you must visit your doctor, because most of the skin lesions may have some itching tendency, may irritate the skin, so that discomfort will lead to excessive cry, inconsolable cry. Then you need to visit your doctor, pediatrician. And most important, bleeding or oozing of blood from any natural opening or skin site, then you need to visit your doctor. We can take questions. Now, most important thing, what should be the takeaway message for caretakers or moms? Baby skin is very delicate.